The thing with surgery is that if you're in the correct plane and you're operating in the right places, there won't be bleeding. If I cut this here, it would bleed, but if I cut where that see-through area is, there's no vessels and everything is fine. What we're going to be watching today is the sleeve gastrectomy. And it is one of the most popular weight loss procedures that is performed in this country. Essentially what we're going to be doing is making very small incisions about the size of a lentil. And then once we get access to the abdominal cavity, we are going to be reducing the size of the stomach from about 1.5 liters down to about 250 cc's. So down from a big bottle of Coke to about a can of Coke. This serves two functions for weight loss. One is the volume reduction, and the second reason is that the part of the stomach we're removing actually makes a hormone called ghrelin. And ghrelin has essentially been dubbed the hunger hormone. So once we've done the removal of that part of the stomach, not only do patients eat less because they have a smaller stomach, they actually have a lot less hunger and a lot less desire for food. All right, so all of this fat, I'll take a banana please, is omentum. That's what the yellow stuff is. It's essentially fat. And then we have the stomach. All of this white stuff right here is the stomach, and it's a large, big organ, and it holds up to about 1.5 liters. Now, if you notice, this beating thing up here is the heart. That's just behind this muscle, and if you look carefully, you'll actually see the heart through the little veil there, and that's the pericardium, and you can see the heart beating right through it. Right here is the diaphragm muscle. This is when you go and you have skirt steak. All of this stuff right here is the same as skirt steak. It's a diaphragm muscle. It's a flat muscle through which is a small hole at which point the esophagus crosses from the chest into the abdomen. We're going to be doing a hiatal hernia repair. You can already see that it's dimpling. That dimple shouldn't be there. As I dissect it out, you'll have a better view of it. Back here, you have another solid organ, and it is the spleen. It actually has a lot of attachments to the stomach, and they share some blood supply. So we'll be taking those blood supplies, and you'll get a better view of the spleen as we take those away. And as I've already pointed out to you, this right here is the liver, and it's actually just the left lobe of the liver. The liver actually has another whole half of it on the other side that you can see we're not even going near it. That's the right lobe of the liver. And the patient's right lobe of the liver and the right diaphragm. So we're going to go back, and the first step to this surgery is actually transecting those vessels that I mentioned to you. They're called the short gastrics.